tonight. Very excited to see all of you. Let me and sorry about that. I got it. No worries, it's over. Just wanted you to repeat that. I wanted everyone to hear that multiple times just to make sure it really sunk in that we have a packed agenda. We're gonna get started in a minute here. Awesome. So, oh man, over 200. Okay, let's get rolling here. Really excited everyone has joined. My name is Becca Miller. I am the legislative director here in District 1, and I'm really excited to be on with all of you tonight. Just a little bit of housekeeping. The first thing is that for questions, there should be an option to chat CWA D1. So if you have any questions as we're going, this is pretty somewhat dense material. So if you have any questions as you go, please feel free to chat CWA D1 directly. And if we don't know the answer, we'll get back to you. And you can always feel free to follow up with us after. I'll make sure my contact information is also there. We also are recording. So as you heard, so we are recording. This will also be sent out after, because I'm sure you're going to want to refer back to all this really important information. And lastly, I have multiple screens here and I'm doing tech. So forgive me if I look off to the side. That is what's going on. Thank you so much to everyone for joining tonight at 6:30. That is really great to see how much interest there is in this issue. In just a minute, we're going to spend the night talking about how we're going to combat rising healthcare costs. But before we before we just get started here, I do want to see who's in the room. So I'm going to start, if I can figure it out, I am going to start this poll. And if folks could just answer what type of sector you work for. I'm going to see if we have local government or state government, private employment. Let's see who we have here. Let's give that a few minutes. Seconds, because you guys are really quick. Answers are flooding in. Okay. All right, awesome. So we have, I'm going to give this, let's see, 5 more seconds, and then we'll put a stop here. Okay. So let's share these results. We have mostly, well, not mostly, we have a really good chunk of local government. We have state workers. We have a very small bit, but a good representation of private employment. That's really awesome. Good news for all of you. You're in the right place. Everything tonight will apply to every single CWA member, actually all New Jerseyans, right? We're going to talk about healthcare costs in general. The issue, as you will see, is particularly acute for our public sector workforce. So I'm really glad to see such a great, strong showing here tonight. But there's a little something for everyone. So one of the most important things I want to do tonight is just thank you for being here. This is going to be an enormous lift, a big campaign that we're launching here, taking on the state and the hospital and the health insurance industry. It is not exactly a small task. So thank you so much for joining us to learn about this. And before we get started, I just want to kick it over to Billy Gallagher, the assistant to the vice president, to say hello.
Good evening, sisters and brothers, and thank you, Becca, for starting us off. First of all, I want to thank everyone for joining us tonight on this webinar in our campaign to fight for affordable and quality health care for all our members in New Jersey. Healthcare is a human right and is one of the most important issues to us in CWA. Our healthcare system is broken, and increasing healthcare costs has been a major problem for all our members across the district. But the problem has especially been acute for our local and state workers here in New Jersey. CWA members and taxpayers have been forced to shoulder the burden of rising costs without improvement in healthcare services or even increasing utilization. For years, our healthcare costs have become increasingly unaffordable, and while we've been doing what we can at the bargaining table, enough is enough. We have no choice but to launch a massive public campaign to take this issue head on. Controlling costs and making healthcare more affordable for thousands of public sector workers will reduce costs for taxpayers and can set a pattern for private insurance in the state as well. Taking on the state and the health insurance industry and the hospitals will not be easy. These are some of the biggest players in our state. Since 2000, Horizon Blue Cross Blue Shield has been the fourth biggest spender on lobbying in our state, spending over $16 million influencing elected officials. The New Jersey Hospital Association was number six, spending $14 million. This is a David and Goliath campaign. But believe me when I tell you, we can fix this. Our members, you, know how to fight. We know how to fight and we know how to mobilize. We know how to demand a seat at the table. Fixing this problem will take everyone on the Zoom tonight and many more to be involved at every step of the way. But we will fight until we fix it. And when we fight, we win. I just really want to thank everyone tonight for joining us on this webinar. There's going to be a lot of information, and I just want to tell you how inspiring it is for myself and my District 1 staff to see so many people on their own time dig in here and get on and join the Zoom tonight and understand the fight we have and what we're really going to need and understand the involvement we're going to need from every member and every local in New Jersey to be successful. But I have all the faith in the world in our members in New Jersey, our staff, our from the locals, the district, and when we fight, we win. And I'm going to hand it back to Becker. Thank you for everything, and thank you for getting on.
All right, awesome. Thanks, Billy. So let's get started. And hopefully, all right, can everybody see my screen? Give me a nod. Okay, awesome. All right, so let's talk about the agenda tonight. First, we're going to just do an overview level setting of the New Jersey healthcare landscape in terms of costs and spending. We're then going to talk about how premiums get developed and, very briefly, a quick explainer on how our premiums are developed and the rates that we're paying, the contributions come into play here. We're going to talk about the consequences of those. I will, spoiler alert, it is not good. And then we're going to end with our plan to win. So I think we can all agree that we all deserve high quality and affordable healthcare, but unfortunately that is out of reach for far too many Americans and far too many New Jerseyans. This is an issue that folks across the country are dealing with. It is not unique to New Jersey, but as you will see, there's definitely a component here where New Jersey is facing a particularly challenging time with healthcare costs. About 50% of adults worry about affording their monthly health insurance premium. So it's really no surprise that this is a #1 issue for voters, has been consistently for years. It continues to be, even in the last election. This is a #1 political issue for most Americans. And it's really important for us to remember that because we're going to be launching a political campaign. And this is a very important issue that across the aisle, we need to demand support on. So just to get a quick gut check here, I'm going to do another really fun poll, if I can do it, and ask, how concerned are you? How personally concerned are you about your healthcare costs? Oh man, they're pouring in. Okay, I'm gonna give it a few more seconds. Okay. Well, I think this tracks because you all are taking time out of your night to join us when it's dinner time. So that tells me that this is maybe some selective bias here, but what I'm seeing in this poll, and I'm going to show you right now, 85% say very concerned, the rest say concerned but not too mild, and just 1% is mildly concerned. So nobody is not concerned. So I think we can all agree this is a problem. Okay. So, we know it's important to you. Before we get started, we know it's important to you, and we're really lucky that tonight we have one of our very own members, Naima Devine, who is a member of Local 1032, working in Middlesex County Social Services, who's going to share her story on rising healthcare costs. She's the chief steward of her unit. She has over 12 years of experience, and we're really lucky to have her here to share how this has impacted her. Naima?
Hi, everyone. Thank you for having me speak today. Basically, I've been with the Board of Social Services for 15 years. So when I first took this job, it was for stability and basically, good benefits to be able to take care of my family. So, mind you, this is 15 years ago. And for a family, right, it was for me, because I came in at a different tier, it was $52 to pay to, to pay for the medical benefits, right? So, of course, that was fantastic for me coming from private sector when we had to pay a lot more than that, right? That was one of the main reasons why I decided to come to public sector. So fast forward, 15 years later, and we are in chapter 78. And chapter 78, since it started, has been a nightmare. The medical costs are so, like, it's just so ridiculous, the amount of money that comes out of my check, twice a month now, right? So here I am. I just got promoted in October. So I'm promoted in October, and I have my promotion raise, and then maybe a month or two later, I have my merit raise. And now I'm like, okay, I'm doing good, right? I'm balling. I'm in the big leagues now. And now the medical cost is basically eating up the raise. So it doesn't matter what you do. It's like you take 2 steps forward and you're still 5 steps behind, right? And so now at this point, my medical, I'm paying, you know what I'm saying? And I'm just like kind of rounding up just a little bit, but I'm paying like almost $800 a month for medical for 3 people. That's insane, especially with all the costs and the growing, like the inflation of everything else. And then to have to pay this much for, for my medical. If you make $1 more, the cost of living raise that we receive, that money is, you don't even see it in your check at this point. So I'm definitely joining this fight because something has to be done. Like, and I'm not trying to sit here and say, oh, I shouldn't pay for medical. Yes, I want to pay for medical. And because I want to make sure that I have good medical. But to pay such an exorbitant amount is just too much. And so, I want to thank you guys for, taking the opportunity to listen to, to what we're saying and trying to understand what we're saying and understand that this chapter 78, we have to find a way to get off of it because it's really, it's at this point is detrimental to us. Thank you.
Thank you so much, Naima. That's exactly right. And that's what we're here to talk about. Thank you for sharing with us. I think, this is a political issue. This is a big issue for all of us. It means something on the everyday. So let's dive right in. Let's get going here. Dan, I'm going to ask you to, Dan Reynolds is our Assistant Director of Research here at CWA, and he's going to go ahead and give us a quick kind of landscape overview of what we're dealing with here in New Jersey.
Yeah. Yeah. Thank you so much. And thanks for having me on this call. I've been at CWA 15 years, working both supporting our bargaining teams as they bargained on healthcare and our policy work on healthcare. And I've just seen from both sides what an important and really difficult issue this has been. So I'm really excited to be a part of this call and to give you all that kind of big picture overview of what the landscape looks like. And I like to just cut to the chase here when I start these presentations and just tell you, here's what I'm going to go through some graphs and charts and things, but a bottom line, these are the takeaways from what I'm about to go through here tonight. Number one, New Jersey has high healthcare spending compared to the rest of the US overall. And if you zoom out bigger, the US healthcare spending far exceeds every other wealthy country that we could be compared to. So the big picture, that's the big picture. That high spending is largely explained by high prices for healthcare goods and services, not overuse, not high usage by members of healthcare services. It's about prices. Studies show that those high prices and spending do not get us better care or more care. Higher quality, it does not correspond to those high prices. And then what we've seen across our units, cost shifting does not control cost. Higher deductibles, higher copays, higher coinsurance, That does not control the cost problem. Instead, it worsens the cost problem by creating financial obstacles for our members who need care. So that's the big picture takeaway. I'll go through data here, but those are the 4 big pieces that I'm here to talk about tonight. So, okay, so we'll dive in here. Point number 1, New Jersey has high healthcare costs compared to the rest of the country. So this is, you can see there's the top 5 highest spending per capita in the US, and then there is New Jersey at number 11, 16% higher than the average in the US. And New Jersey is part of a high-cost region. You can see New York there, Delaware, Pennsylvania is not far behind y'all at 14. So you all are situated in a high-cost region, and New Jerseyans bear the brunt of that with those higher than average costs. And not only are costs high, but they're growing faster than the rest of the US. This shows, you can see the US there in orange, and then New Jersey in yellow. The rest of the US over the past 10 years has seen annual growth of 3.75%, 3.75%. New Jersey has well beaten that at 4.27%. So 0.5% higher every year, which compounds, and that difference has grown every year. But then when you zoom out at that bigger picture, so New Jersey's higher than the US, but if you look at the US compared to every other wealthy, comparable country, US spends twice as much per person on healthcare costs compared to those other countries. And $6,000 more per person in 2022. And unfortunately, our high costs don't get us better care. So this chart shows the number of treatable deaths per 100,000 people. That's basically deaths that could have been avoided with healthcare services. The US has consistently had higher numbers of treatable deaths compared to comparable countries. And in 2020, had nearly twice as many treatable deaths than the average comparable country, 98 in the US versus 55 for the average comparable country. There are many factors that contribute to this sort of paradoxical situation where we're spending more and getting worse results. But a significant and important one is that a majority of our higher spending doesn't go to more or better healthcare services. It goes to paying higher unit prices for the same services. And on the next slide, you can see that problem of high US prices is only getting worse. Between 2018 and 2022, prices grew 14%, much faster than national utilization of healthcare services at 4.4%. And according to recent actuarial review of New Jersey state healthcare benefits, this overall trend matches the experience in our plans. Under the New Jersey state plans for active employees, medical claims for outpatient services increased by 12%, which was driven by an 11% increase in cost per visit and only a 1% increase in utilization. Similarly, inpatient visits decreased by 4%, but the cost per visit increased 12%. So it's a similar story for our plans that we are seeing overall. Higher prices driving the higher costs. And as you all are aware, these prices and cost increases don't just affect our ability to afford care, they also affect our ability to bargain for better wages. Here, the advocacy group, Families USA, looked at rising hospital prices. You can see that huge bar there in the red, and rising insurance costs, that almost as big bar in the yellow, over the past 20 to 30 years, and compared that to the growth in inflation-adjusted wages over the past 40 years. That's that green 14.8%. Our wages have not nearly kept pace with these exploding costs. And as a result, healthcare costs grow as a portion of our compensation from 8% on average in 1980 to 25% on average in 2020. That's money that could have gone to higher wages or improvements to other benefits, but instead is funneled into higher healthcare costs. And I think intuitively, we would all think that those high prices that we're paying, we must be getting higher quality or better services in some way as a result of paying more. But studies that looked at this have just saying that that's just not the case. So here, this graph, it has 3 bars based on hospitals with relatively low, medium, and high prices. So on the far left are hospitals with lower prices compared to Medicare, the medium in the middle, and high on the far right. Medium priced healthcares, that middle bar, are more likely to have a 5-star rating according to CMS. CMS ratings, various measure quality measures like mortality, safety, patient experience, and readmission rates. So those medium priced hospitals actually have higher quality compared to the higher priced hospitals there on the far right. So the high prices we're paying don't necessarily mean that we're getting better care. And, you know, over my entire career at CWA, employers and insurance companies have been well aware of this fact. And unfortunately, the dominant strategy that employers have pursued to fight this trend is something that they call healthcare consumerism, which basically means higher deductibles, more out-of-pocket costs. Employers hoped, you know, that those higher costs would force patients to shop around and get lower priced care. But this strategy has been just completely ineffective, and in the long run actually makes the problem worse. That's because patients do not have the time, the expertise, or access to the information necessary to be hunting for deals on healthcare. Comparisons of hospital prices are difficult, even as there's been a push for more price transparency. Patients rely on their doctors' directions and are unlikely to know what care is needed and what care isn't. What healthcare consumerism has actually accomplished, those higher deductibles and higher costs, what that's actually accomplished is driving down all kinds of care by putting up barriers, financial barriers. Patients cut back across the board when they run into those big deductibles, both on high cost care and on the low cost preventive care. So this chart here shows a recent study of consumers in high deductible plans that cut back on low cost care and high effective care like blood sugar and cholesterol monitoring and cancer screenings. When consumers cut back on important preventive care, it leads to worse healthcare outcomes overall and higher costs down the road from increased hospitalizations.
Thank you so much, Dan. That really sets, the context for us. So that's what we're working with. It's not a pretty picture. And it's going to get worse because I'm going to tell you exactly what's happening with our costs here in New Jersey. And I actually don't have to tell you because you all feel it in your paychecks. So since 2022, healthcare premiums for state workers have increased by 40%. This is abhorrent. And it gets worse because for local government workers, we've seen a 59% compounded increase in premium rates. This is pretty wild. So just to contextualize this for you, taking, for example, a family plan, New Jersey Direct 10. In 2022, the cost of that plan, that premium, was $33,395. Just 3 years later, it's at $50,600. That's an increase of $17,000. That is, almost a $20,000 increase over 3 years. So let's take an example. A local government member may be contributing 12%. That means in 2022, they were contributing $4,000. Now, just 3 years later, over $6,000. This is obviously not sustainable, right? That is a crazy increase. And it's not because, as Dan just said, it is not because we are using more care or getting better services or better quality or better outcomes. It's the same plan, same care. In the private market, we see that the average family premium grew in 1 year, so in just since 2023, grew by 7%. This is higher than inflation. This is higher than average wages. So again, whether you're in the private market, in the public market, both plans have grown in a way that is extremely fast, extremely steep, faster than inflation, eating up wages. But we can obviously see that the problem is very acute for our public sector workforce. So that was a lot of numbers, but here's the bottom line. The cost of premiums are growing extremely fast. It is untenable and it's unsustainable. The cost we are contributing is also growing substantially. It's eating away our wage gains. And it really doesn't matter if you're in private sector, public sector, this is an issue that applies to everybody. So we've covered healthcare costs, we've covered spending, we've covered that it's not because of us, it's not because of better quality, not getting better results. It's only to line the pockets of health insurance CEOs, hospital CEOs. So before we talk about how to fix this, I want to make sure we're on the same page, do a quick explainer on how this works. You all probably know, but I just want to reiterate. So 54% of Americans have their health insurance through their employer. For our members in the state plan, not in the state plan, we bargain directly with an employer over plan design and the contributions. However, the public sector works a little bit differently. So all New Jersey state executive branch and New Jersey judiciary workers are in the state health benefits program. This provides medical coverage to employees and retirees and dependents through the Division of Pension and Benefits, and that goes through the Treasury. So those are some key players there. For local governments have three options for healthcare. They can be in the state plan, they can go with a private insurer, or they can do self-insurance. We don't know exactly, but our best guess is that about 30 to 35% of local governments are in the state plan. So for state and local governments that are in the state plan design goes through the plan design committee. The plan design committee is 50% labor and 50% management. Plan design is like the outline of what your plan will cover, services, costs, incentives, levels of co-payments and deductibles, out-of-pocket expenses. So if you're not in the state plan, your plan design is up to that, your individual bargaining contract. If you are in the state plan, the plan design is substantially similar, right? It's substantially the same. However, the plan design process is completely separate from the rate setting process. So for rates, this goes through something called the State Health Benefit Commission. So this is 60% management on this commission and 40% labor. And this is where the costs, the rates of the premiums are decided. And we are outnumbered. There's not equal governance here. And furthermore, there's no representation of local government. These are two massive problems with the governance of the state health benefits plan. So rates go through the State Health Benefits Commission. And like I said, there are lots of issues with it. It makes it hard. It limits our ability to fight back there. So how are they set? So first, the state has a third-party actuary called Aon, and they do rate renewals every year. So they go through a rate setting analysis. They look at last year's trends, they look at claims, they look at the groups that they're servicing, and then they make projections of what the increased cost will be. They'll make a recommendation. First, there's an interim recommendation. It usually comes out in March. And then there's a final recommendation that comes out in June or July after the state budget is done. Once that happens, the State Health Benefits Commission has to approve the rates. This typically has to happen no later than September for the next year's enrollment. The state's rate calculations then influence the private market. They increase for everyone, right? One thing I will say is that this third-party actuary, Aon, there are serious concerns about their integrity, the rigor of their analyses. There's very little transparency. There's essentially no oversight or accountability. So there are significant issues with the process that results in these rates. In addition to that, whether it's Aon or a different actuary, there should be levers in the actual process that would ensure the type of transparency and accountability that you would want when it's potentially resulting in the level of increases that we've talked about, right? So while I want to call out that we have major concerns about Aon specifically, we also just generally have concerns about a process that would allow this, right? So it's been in the news. It's been in the news. Now, as Naima mentioned, our contributions for local government come through a place called Chapter 78. So worker contributions were set by this Chapter 78 legislation. It set up a mandatory contribution schedule that's a percentage of the premium. So as the premium increase, our contributions increase, right? It's tied to that. This is the default, but it does allow employers and the union to negotiate something separate. So at the state level, CWA has been successful in bargaining a replacement to Chapter 78 with lower contributions. But on the local government level, CWA, it's been virtually impossible. You have to go to each local government and do an individual negotiation. It's been very difficult. It's one of the reasons that we need a legislative solution to ensure parity among local governments, right? So what happened in 2025? My first foray with Aon and this whole rate issue. So the most recent rate adjustments were absurd. For local governments, we saw a 16.3% increase. For state governments, 10.6%. This is ginormous. And as we talked about, as we said earlier, but it bears repeating, since 2022, local governments have seen a whopping 59% in compounded increase, and state governments 40%. So again, just to put this in real numbers, let's think a typical local government employee, right? Maybe on average earning $65,000. They paid $8,000 for a family plan last year. This year, that same employee is paying $9,600 just 1 year later, same plan, same benefits. This eats up any wage increase. It is compounded with the fact that we have, rising inflation. This is a very serious problem. So what are the consequences here? I mean, this is not a long, it's not a secret here. The consequences are really unaffordable. It's really unaffordable at a time when there's also mass issues with affordability in housing and education and all of these other issues, right? This is tied into this problem. It also really decreases our bargaining power. If we're spending all of our bargaining, power and political capital trying to tame down these increases, it really undermines what we can win in other ways, what we can win in wages. It also leads to an increase in property taxes because local governments have to take that full cost of the premium. They have to pay the full cost, right? So as the costs go up, they're paying the full thing, and they're going to pass off those costs to the people that live in their areas, in their towns and cities. So this really does increase costs for all of us. And I'll also say that, it sets the market. It's a market influence, right? Because then all of these other insurers are going to say, hey, they're getting that much. Hospitals are saying they're going to get this much. And then they can raise what they're doing because of this big contract, right? So what happens? It drives local governments out of the plan and then increases the expense for all of us. So between 2022 and 2024, there was a significant decrease in local government members, about almost 20%. So that means that those who are remaining, they're remaining because they have higher healthcare costs and claims. And that means that they can't really go and get better prices in a different market, which then increases the state health benefit plan cost. So, and actually Aon even accounts for this. I think they call it a selection, add-on. So they add a percentage saying, oh, well, the population's it's going to have higher claims in this population because we're losing other people in the plan, and they even increase it more. So I think I hope I've convinced you that this is an unsustainable problem. I hope you already knew that coming into this call because you feel it in your paycheck. And it's going to get worse. The projections aren't that this is going to level off or get better. It's just going to get worse. So, and the consequences of that, particularly in light of the administration and potential federal funding concerns, right? This rise in state healthcare spending, it's going to make it harder to fight for money on other things. It's going to compromise our members and other New Jerseyans' access to care. It's going to mean inequitable health outcomes. Costs are going to rise. It's not going to be good for anybody, whether you're in the state health benefits plan or not. So this impacts everyone, regardless of where you are. And so what are we going to do about it? How are we going to win this? So as Billy said earlier, taking on the health insurance and hospital industries and the state really will not be easy. We are going to need every single member that is on this call, and we're going to need 10 more for every one of you, right? We're going to need all of our members to really participate here because we have to throw our weight around in order to win this. Like Billy said, The number 4 lobbyist over the last 20 years is Horizon, right? The number 6 lobbyist is the Hospital Association. We are up against big players, but what they don't have that we have is people power. We are the ones who knock doors. We are the ones that make calls. We are the ones that contribute to PATH. We are the ones that are voters, right? We are the constituents. So it is really important that we take this campaign and we really politicize it and we fight back. So what are we going to do? We are going to introduce a comprehensive piece of legislation to address affordability on premiums, cost control, right? Because we can't let costs continue to spiral and spiral and spiral, and governance and transparency to put in some of those guardrails that we need to prevent this from being a longer term problem. We're going to need to lobby our legislators. We're going to need to talk to elected officials and build support. It couldn't be a better time to do it because right now the governor there's going to be an election for the governor and the entire state assembly is up for re-election. So at a time where they really need us, we really need them. And what we need is to make sure that all candidates who are working with CWA are ready to fight for this issue because we can't, enough is enough, right? And the way that we do this is we mobilize, we get involved, we show up in the streets, we knock the doors, we have meetings, we do all of the things so that they know that we're here, we're paying attention, and that we need them to step up and fight with us. So that's going to mean lobby days in district or in Trenton. It's going to mean phone calls. It's going to mean email actions. It's going to mean petitions. And we are hoping for a massive mobilization in Trenton, probably in late May to time it with the budget. So stay on the lookout for information from your local about that. So what is our legislative proposal? It's 3 prongs, right? So affordability. We want to legislatively replace Chapter 78, get rid of Chapter 78. Naima, we're going to get rid of it. That's the plan, with lower contribution rates for all public employees. That's what we're going to try and do. Cost control, that's number 2. So there's a model called reference-based pricing that we are supportive of, where it ties reimbursement rates to a percentage of Medicare costs. That means that a provider, no matter which provider in which geography, can't charge more for a specific service. It's tied to a standard rate. This has been done in multiple states, particularly states with big public sector health insurance programs. So Montana and Oregon and California, we have lots of models to look towards. And then lastly, governance and transparency. We need to reform the State Health Benefits Commission to have more equal governance. We need to require transparency measures in the rate setting analysis, and we need reporting on these renewal calculations. We need to have a seat at the table in a real way. We need access to the data to be informed and make informed decisions. We need a 3-pronged approach to really take this issue head on. Okay, so this is the moment of the night. I know everybody's been waiting for. I know you're all so excited about this issue that you want to take action right now. Don't worry, I have 2 for you. The first is to sign a petition. This is a petition to Governor Murphy to support our plan for affordability and cost control and governance and transparency, and tell him enough is enough, right? So there's a QR code. You can take your phone, you can point it at the screen, and you can send a petition signature right now. You can sign the petition right now. Whoa. I don't know how that happened. The second thing, and actually staff, if you could put the link in the chat. I'm seeing people drawing on the screen. I don't know how that's happening, but okay, cool. Little intrigue here. The second thing to do is that we are trying to collect information from members who are interested in being part of this fight. So on the other side of the screen, there's a QR code, and we'll also put the link in that will allow you to fill out a form to stay involved in the campaign. And then this form will go to your local, so your local can make sure that they know that you want to be involved in this campaign. So these are the 2 asks I have of you tonight. We have 300 people on this Zoom call tonight. I want to see 300 petition signatures, 300 people willing to make a phone call, signing up on this form, willing to make a phone call, go to Trenton, talk to a legislator, show up at a rally, those kinds of things. This is how we start. Let me see if, okay, so I see, oh, good to know. Apparently for the Google Doc form, one activity is only possible to choose. We will fix that. Thank you for flagging that. We will fix that right now. Awesome. All right, so I'm going to give everybody a minute or two here to take down the links or to take a picture of the QR code. I'm going to give everybody one. Okay, form is now fixed and working for multiple options. Thank you, Anna Marta, so quick. Okay. Awesome. I still see folks on their phone, so I'm going to give it another minute. Awesome. Okay. All right. So form and petition links are in the chat. QR codes are on the screen. The responses are pouring in. That is awesome. So I got a question here. Is the petition just union members or can other state residents sign it? Sign it. Open it up. Absolutely. The more the merrier. And one other thing I'll flag is that in a campaign like this, what's really important is stories, right? We can talk all day about the numbers. We can show folks how the percentage increases. We can make a factual case here, but what really moves legislators is hearing directly from constituents with meaningful stories. So like Naima did today, if you have a story, if you're willing to share, if you're willing to say, you know, how rising healthcare costs have impacted you, what they've taken away from you, what did you have to spend on healthcare that you would have preferred to spend on your family? You know, or that was some other cost to you. It'd be really helpful if you flagged for us that you'd be willing to share your story. So you can either mention it to your local leadership or, you know, send me a direct message or put it in the form that Anna Marta just re-upped in the chat. We really need to start collecting these stories because, like I said, this is a really tough campaign. We're up against very powerful players, and we're going to need to, you know, have really direct conversations with legislators, sharing real stories of how this has impacted you. So please, if you're willing to share a story, please let us know. We're definitely looking for that. I don't know how folks are colored on the screen, but and maybe I don't know if I'm the only one who sees that, but that's really great. Thank you all for doing a little art to end the night. That is what we have for you today. So thank you all for joining. Really appreciate you being on this call tonight. Have a great night.